everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, Lymphoedema Physiotherapist and ESSA accredited exercise physiologist. In this episode, I'm going to be talking about a really common question that pops up in the clinic on quite a regular basis, which is, can I sleep on my affected side after breast cancer? Now, I just want to point out here that the affected side means the side where you've had lymph nodes removed from your armpit, or your armpit has been radiated. So the lymph nodes in that armpit have been radiated. So why this question pops up is because people are quite concerned that if they sleep on their affected side, that they might be putting themselves at risk of lymphedema. So that's the question I'm going to answer in this video. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below. I'd love to find out what topics around breast cancer you'd like more information on. And if you have any questions related to this video about side lying and risk of lymphedema, then please again leave a comment in the section below. Okay, so firstly, I just want to put a small caveat on the fact that if you are very soon following breast surgery, there may be a post-op restriction as to when you can start to side lie at night. So I want to distinguish that this little caveat is more to do with post-operative restrictions rather than risk of lymphedema, but I felt that I needed to pop this little bit into this video because if you are about to have breast surgery or you're 1 or 2 weeks following breast surgery, then it's more than likely your breast surgeon has suggested not to lie on the affected side. You may have even had a double mastectomy or a breast reconstruction type of surgery done, so the same rule tends to apply. So talk to your medical team if you're not sure, because usually there is a post-operative restriction. It's often around 4 weeks that they're suggesting don't lie on your side, or at least don't lie on your side if you have symptoms persisting that are, causing pain and discomfort and whatnot. So definitely talk to your medical team. But that point is more to do, like I said, with post-operative restrictions rather than risk of lymphedema. So let's get on to talking about why sleep is so important, because unfortunately when you go through breast cancer treatment and sometimes following breast cancer treatment, your sleep can be disturbed. There are so many physical things that can cause sleep disruption, such as chemotherapy. You're often given steroids to combat the side effects of nausea from the chemotherapy. And guess what steroids do? They keep you awake all night. They cause a level of insomnia typically. So that can disrupt your sleep. You could have reflux or heartburn being caused from chemotherapy. You might have radiation burns, which makes it too uncomfortable to sleep on your affected side. You may be on hormone blockers, which are the medication that a lot of breast cancer survivors get put on to reduce their risk of breast cancer recurring. And hormone blockers are known to disturb sleep. So there's so many side effects of breast cancer treatment that can already cause issues with sleep. And the most important message I want to push in this video is that sleep is so important for our health, and that's from a level of your immunity, but it's also broadly your physical and mental health. I think everybody who's, say, had a baby would appreciate that sleep deprivation. If you're getting up during the night multiple times to go and feed your baby or to attend to your baby, you will certainly appreciate that sleep deprivation really does affect you physically and mentally, and it's not a very pleasant place to be. So, and the same goes for breast cancer treatment. It is so common that the side effects of treatment are disturbing our sleep quality. So if we know that sleep is vital to our health, then I feel that we really need to prioritize having a good night's sleep. Now, as to answer the question of does side lying after breast surgery that's taking into account that this is, outside of post-operative restrictions. Can side lying after breast surgery cause lymphedema, or am I at higher risk of lymphedema if I lie on my affected side? From every bit of research that I can look into, that I can try to find, as far as I'm aware, there is no research evidence to suggest that side lying on your affected side is going to potentially cause lymphedema. And there are a few things out there that we know can potentially trigger lymphedema, but as far as side lying, it doesn't seem to be the case. And I think, like I'm, alluding to in this video, the most important thing is to allow a breast cancer patient or a breast cancer survivor to get a good night's sleep, particularly for the immune benefits. So as health professionals, if we're saying, it's probably not a good idea to lie on that side because you might get lymphedema, and that message is unfounded from a research perspective, I think that's quite unfair for the patient, because as I said, there's so many other side effects of breast cancer treatment that can cause disruption to your sleep. And as one more thing, if health professionals are saying, don't lie on that side because you might get lymphedema, and it's not true, then the patient's in even more of a predicament to get a good night's sleep. It's not a very pleasant thought that your body, naturally finds its position of comfort when you go to bed, and that might be say, lying on your left side. So if your left armpit has had lymph nodes removed, and your body constantly wants to go to the left to side lie at night, but your brain's going, oh my gosh, no, don't lie on that side because that might increase my risk of lymphedema, I think your sleep is going to be disturbed even more so. I know patients will tell me that they've taught themselves to lie on the other side, but I get the inkling that one of the best ways you can get a good night's sleep is just to go to sleep in a position that is of most comfort for you. Now, the only caveat I'm going to put into this video on this topic is the notion that if you are a breast cancer survivor and you've had lymph nodes removed from your armpit and you have tried lying on your affected limb at night, and you have a suspicion that by side lying you are getting a swollen arm, then what I would suggest you do is get yourself to a lymphedema therapist and get assessed. So don't guess by yourself that you might have lymphedema because you've laid on that side. Go to a lymphedema therapist and at least get an assessment towards a diagnosis or not of lymphedema. So rather than make the assumption that I laid on my side, my arm's swollen, that must be lymphedema and it must be because I laid on my side, go to a lymphedema therapist and actually find out if you have lymphedema in the first place, or that it may be a symptom that is not lymphedema, but it is, or if it is lymphedema, that it's related to an activity other than lying on your side. So there are a lot of patients I see that sometimes they will assume they have lymphedema when in actual fact it's nothing to do with lymphedema. And this comes back to getting good clinical diagnosis, and even if you're able to access it, getting a Lymphoedema Index score taken. I know not everybody has access to these devices, but if you do, I would implore you to go and get that done if you are suspicious of lymphedema. So I think the take-home message is that, with this caveat, guys, is that there would be potentially what we call grade 5 evidence, which is anecdotal evidence, which essentially means that someone or some people out there might have experienced lying on their side and have potentially woken up with a swollen arm, and it might be lymphedema and it might be related to lying on their side, but there doesn't seem to be any strong clinical evidence to suggest this happens. But in the circumstance that people out there watching this video are thinking, well, no, I'm sure that it was lying on my side that caused that arm swelling, then, as I said, get an official diagnosis from a lymphedema therapist, and that would be the only reason that you would potentially train yourself to lie on a different side. If you really found that consistently lying on your affected side at night time was causing increased swelling in the limb that's affected, and that you've been diagnosed with lymphedema by a lymphedema therapist, So that's really the only time where I would say, okay, potentially there is a reason to not lie on that side. I suppose one of the other take-home messages though from that point is that I wouldn't say to any patient who's had lymph nodes removed, don't lie on that side, don't lie on your affected side just in case you get lymphedema. That's where I feel we can let patients down, is by sort of putting the fear of God into them about certain activities that have no research evidence behind them. So if you are at risk of lymphedema and you want to lie on your affected side at night, I would say go for it, because if that prioritizes a better night's sleep for you, then I think that is way more important personally than avoiding an activity for the potential risk of lymphedema when there's no research evidence behind it. Thank you so much for watching this video, everyone. I hope you've gained some great information. If you have any questions related to sleeping on your side and lymphedema risk, then please leave a comment in the section below. I would love to hear from you and find out what other topics around breast cancer you'd like more information on. I'll be back next week with another video. I would also like to announce a very exciting piece of news, that I have booked dates to do video interviews with 3 fantastic women who I work very closely with. Julie Bolton, my breast cancer counsellor, Tracy G from Tracy G Lingerie Prosthetics, and Fiona Rogers, who is a women's health physiotherapist, who I send all of my breast cancer patients to most of the time. So those ladies will be doing video interviews with me in a few weeks on very specific topics, and I hope we can get a few interview topics out of them. So I look forward to doing them. I will see you guys here next week for another video. I'm Jen McKenzie, the breast cancer physio. I will see you next time.